Right. Welcome to High Country Doulas presentation on perinatal mood and anxiety disorders. We are going to share a little bit more about this phenomenon for women who are in the perinatal period. That means pregnancy, birth, and postpartum. As a postpartum doula and a labor doula, I support a lot of women who experience symptoms of mental health that are specifically a complication of being pregnant or postpartum. So we're going to learn a little bit more about that today. My name is Allison Rollins, and I am a co-owner of High Country Doulas. I am a labor doula. I'm also a postpartum doula, an infant feeding specialist, and a postpartum placenta specialist. So I work with a lot of parents who are going through the struggles of mental health concerns that are specifically related to their pregnancy and postpartum period. And today we're going to talk a little bit more about what that looks like for different moms and families, and just have more awareness of what that might look like in case it shows up for you, or maybe you've experienced it before and you're concerned about this time. Maybe you're pregnant again for the second or third time and really concerned about it. So we're going to talk a little bit about how that looks for different people. And as we go along, please join us making comments. If you're watching the recorded session of this, or if you're watching the live session, go ahead and make some comments or questions in the chat bar so we can get those answered for you today. Awesome. So again, my name is Allison Rollins, and I love helping and supporting women and families as they journey through that very transformative time of pregnancy, birth, and that postpartum, home with newborn. If you are watching this as a recorded, please make a comment. We'd love to hear about how you navigated your postpartum, or any particular things that you found helpful in our webinar today. So that pregnancy, birth, and newborn period are really such a beautiful time. It really is this delicate time in a woman's life that really has a profound kind of impact on us. And we want to be able to help you create an awareness about what perinatal mood and anxiety disorders are, and letting you know if that might be something that you are experiencing, or you may have a friend or family member who is experiencing them, and helping them to make that through. Awesome. So let's get started. So what is PMADs? The acronym for PMADs stands for Perinatal Mood and Anxiety Disorders, and refers to that emotional shift an expectant person may experience during pregnancy and after the birth of their baby, or after the birth of their baby. For familiar terms of these emotional shifts could include pregnancy anxiety, pregnancy obsessive compulsive disorder, or OCD, baby blues, which is a very commonly heard one, postpartum depression, postpartum anxiety, postpartum post-traumatic stress disorder, and postpartum psychosis. Historically, the focus on mental health surrounding childbirth has been on the postpartum or after period. However, really in recent years, there have been a push to recognize that for some, these disorders may show up in pregnancy as well. And today we're going to take a look at the various ways in which perinatal mood and anxiety disorders may show up, as well as discuss the symptoms and the possible treatments. There's really no doubt that this can be a tough topic. It is so very important to be aware of the signs in order to be able to seek help as soon as possible. Most moms feel like getting help quickly can impact how long they have and are dealing with this and the severity. So that's why that education and awareness about it is so key. Let us know if you've heard of the acronym PMAD in the comments below. Right. There are risk factors that may increase the risk of experiencing a perinatal mood or anxiety disorder. These risks may often be tied to emotional, social, or hormonal changes experienced during pregnancy, birth, and the postpartum. Risk factors for perinatal mood anxiety disorders include hormonal shifts of pregnancy and childbirth, sort of like that complication, sleep deprivation, stress of caring for a newborn, and those shifting roles of the parent. So it's a big shift for us a lot of times to go from our former selves into being that parent and what is our role. Changes in thyroid function can also be a cause. Family history of depression or personal history of depression or anxiety. A personal history of premenstrual dysphoric disorder or a personal history of PMADs with a previous pregnancy or birth. Other situational risk factors could include a difficult labor and delivery, unplanned pregnancy, lack of family or social support, traumatic life events surrounding pregnancy or birth, such as a serious illness or death of a loved one. So sometimes along with our pregnancies, we may experience this personal loss, which can be a huge impact to our risk factors. Stress and anxiety surrounding the need to return to work, so financial stresses at home. Unrealistic expectations about parenthood and breastfeeding. Tendency toward perfectionism. Trouble with handling transitions. Living alone. Low income. Now that we know what PMADs are, let's learn a little bit more about them. Pregnancy anxiety. So approximately 6 to 7% of pregnant individuals will experience pregnancy anxiety or panic. Symptoms could include difficulty concentrating, feeling worried or afraid or nervous, just that nervous energy. Difficulty sleeping, your brain won't turn off, you're concerned. Fatigue, just not being able to sleep, not being able to nap, and just wearing down, that real just draining fatigue. Restlessness, irritability, cranky, sometimes anger, repeated panic attacks, feeling short of breath, heart palpitations, and in some cases, chest pains. Many of these symptoms that I listed are a normal part of pregnancy. However, the symptoms are repeatedly experienced. If they are repeatedly experienced, may be a cause for concern. And it is generally recommended to contact your provider if symptoms continue beyond 2 weeks. And I will say too, if you have a history of panic or anxiety prior to pregnancy, I would call before 2 weeks. Has anxiety been a part of your pregnancy? If so, feel free to share your experience with others. One of the things that I think is important with PMADs is just to share what our experiences are, because we need to understand that perinatal mood and anxiety disorders is a complication. So we are impacted as women from our pregnancies and our postpartum and our hormonal shifts into this. So it's something that can be supported through care and through support. Pregnancy depression. For some people, depression may manifest during pregnancy, and this is called antenatal or prenatal depression. The symptoms of prenatal depression are the same as those for postpartum depression, which are feeling overwhelmed, suicidal thoughts, trouble making decisions, a change in appetite, unexplained anger, increased fear, feeling guilty, feeling isolated, lack of feeling connected to your pregnancy, worrying, often excessively, feeling inadequate, inability to sleep, or excessive sleep. About 10% of individuals will experience depression during pregnancy. And these statistics are being updated regularly as we start to learn more about that. We are noticing that there's actually more people who are experiencing this that may not have come forward. So, pregnancy obsessive compulsive disorder, or OCD. This may also be experienced during pregnancy. For some pregnant individuals, there may be a history of OCD before pregnancy. For others, pregnancy may be triggered for their very first experience. There are three real primary elements to this. Obsession. So obsessions, repeated thoughts or images that come to mind. Examples could be fear of contamination by germs, thoughts of images of harming someone. Typically, these thoughts focus on accidental harm to the baby, dropping the baby, those kind of things. A drive for perfectionism, so wanting everything to be completely perfect, may also relate to that real need for cleanliness or sanitizing. Anxiety. So anxiety is often triggered by the repeated thoughts or images. It's triggered by the obsessions that may cause further anxiety, fear, or feelings of guilt. Compulsion, actions or thoughts that are repeated to reduce the feelings of anxiety. Examples of compulsions could be checking, repeatedly checking to make sure that potential sources of danger are avoided. Some pregnant individuals may focus on aspects of their health, such as their pulse rate or your blood pressure. So the need to be able to check things several times a day. Rituals, repeated actions such as cleaning or washing. Constant need for reassurance, asking others repeatedly to make sure everything is okay. During pregnancy, this may manifest as repeated calls to the healthcare provider or repeated visits to labor and delivery for reassurance that everything is okay. And as a doula, we are there for women 24/7 to be able to support them. If a woman is feeling anxious, she's having those obsessive compulsive disorders, as her doula, I really often help her by being available to her when she needs that reinforcement. And oftentimes with providers, they're very busy and often don't get back to them. So I think, as a doula, I see a lot of women feeling very helped and reinforce that assurance that things are okay by just reaching out to me. It can be a really hard space to be in. Maybe this has happened to you, or maybe you know somebody who this has happened for. So the baby blues. This is probably one of the most known things that people have heard about, just those baby blues that occur. It is one of the most common. About 60 to 80 individuals may experience baby blues. Baby blues are typically in that first 2 weeks after the baby's born, and it is short-lived. So you really have it. It usually resolves around the end of week 2, and oftentimes it can be worse in those first couple days after birth. They're typically described, women typically describe this as mild depression with episodes of happiness intertwined. Symptoms can be feeling overwhelmed, restlessness, mood swings, sadness, crying. An example would be like a lot of women will be sitting and nursing their baby, and all of a sudden they feel an overwhelming emotion and just cry. And if you ask them why they're crying, they like, I don't know. And sometimes it's just an overwhelming emotion that takes over them. They may just be loving on their baby and just be crying for happiness. They may just be feeling sad. That is a typical kind of baby blues. And it goes away pretty quickly like it came on. Some women experience just trouble coping, that shift, that real loss of lots of things, sleep, a sense of themselves, a sense of time for self-care, those types of things. Trouble sleeping, of course, fatigue, sometimes exhaustion, and feelings of nervousness or anxiety. While the exact cause for baby blues has not yet been discovered, it is believed that the shift of hormones after birth of the baby triggers temporarily changes in the brain that can contribute to this. Other factors that maybe influence the onset of the baby blues are lack of sleep, unpredictable routines as parents learn how to navigate life with their baby, and how the birthing parent feels about their childbirth experience. Have you or someone you know experienced the baby blues after birth? Tell us more about that in the comment below if you're watching the recorded. So baby blues, I just want to note, typically ends, and it's typically sporadic. It's not every day, all day long. All right, postpartum depression. When people hear the word postpartum, they often think depression. For some people, the word postpartum itself takes on the meaning depression after the baby's birth. However, the true definition of the word postpartum means after birth, whereas postpartum depression is defined as depression following the birth of baby. So we're trying to redefine what that word postpartum is. Postpartum depression affects approximately 10 to 20% of those who've recently given birth. The symptoms of postpartum depression extend beyond those of the baby blues and persist more than 2 weeks. In addition to the symptoms of baby blues, the symptoms of postpartum depression could include suicidal thoughts, trouble making decisions, changes in appetite, unexplained anger, increased fear, feeling guilty, feeling of isolation, lack of feeling connected to the baby, worrying, often excessively, feelings of inadequacy, inability to sleep or excessive sleep. These are all additional things beyond those baby blues symptoms that women who experience postpartum depression can experience. Postpartum anxiety and panic disorders will really affect about 10% of newly delivered parents. Symptoms of postpartum anxiety or panic may include a persistent feeling that something bad might happen, difficulty concentrating on things, often have racing thoughts, difficulty sleeping, fatigue, restlessness, irritability, nausea, hot flashes, and dizziness. Repeated panic attacks that would make you feel short of breath, have heart palpitations, or in some cases, chest pains. Individuals who suffer from panic or anxiety disorders may not be able to put into words exactly what is causing the anxiety or what may trigger a panic attack. Irritability and anger are among the more common ways that anxiety may present itself. And oftentimes when you're in it, it's really hard to self-diagnose it. So it's often really important that people who are around you, your spouse or your partner, is aware of potential symptoms, especially if you have pre-existing conditions that could make you more susceptible. All right. Postpartum post-traumatic stress disorder, or PTSD. This disorder may be triggered by complications or difficulty in childbirth, where the birthing person suffered a real or perceived trauma to themselves or their baby. It is the perception of this trauma that is most important, not the actual degree of trauma suffered by the birthing person, that may serve as the most powerful trigger. And I think this is important to remember, because it is not what others see that birth experience to be, but what the mother sees it to be. How did she feel about her birth? There may be perceived as a lovely birth by partner or spouse or the doctor, but it is not perceived that way by the mom. Possible traumas could include an unplanned cesarean birth, baby taken to the neonatal care unit following birth, a mechanically assisted childbirth, such as a forceps or vacuum delivery, an umbilical cord prolapse, feeling powerless during labor in the birthing process. This is really important, because this is a perception of feeling out of control, which as a doula, I hear a lot of women feel this way, their loss of control. Women are very vulnerable in birth, and it is really important to understand that vulnerability when you're caring for a birthing person. Feeling unheard and unsupported during labor and birth. History of previous sexual trauma or abuse. A severe complication of pregnancy or birth to the birthing person. And this may happen later on, something that may be hospitalization after birth. Some women have a good birth and then end up having complications. So while the symptoms of postpartum post-traumatic stress disorder will really vary from person to person, general symptoms of it include sense of detachment from the experience, flashbacks or nightmares about the triggering experience, feeling as if the traumatic event is happening to the person, again, in ways that are intrusive, avoidance of people and places, thoughts or feelings associated with the experience. So really trying to deny or not wanting to talk about it, not wanting to be around people, and consistent anxiety and panic attacks. While not every person will experience this type of disorder after a traumatic experience, it is not uncommon for individuals to feel at least some of these symptoms listed above as a part of the recovery process. And as a doula, I often help women to talk about that. Sometimes it's really hard. Sometimes you can have a relatively smooth birth, but if a mom feels like she was forced into things or things were done to her without her knowledge, she can really have long-term effects from this and really need to process and deal with it. So it's important to help support her when she's going through that. If the symptoms of this are apparent or noted, please speak to your healthcare provider about that. All right. Postpartum psychosis. So this is the type of postpartum mental health disorder that is something that you hear about in the news. It is the only time you usually hear about it. And so when people think about PMADs, the public often thinks about this, but this is the most unlikely that women experience. Postpartum psychosis really affects 0.1 to 0.2% of postpartum individuals, or about 1 to 2% per 1,000 births. It is exceedingly rare, but it is usually happens in the weeks right after birth. However, it can come up later on, 5 months later on. So it's not specifically normal for that to happen, but just want to note that because it can happen. The symptoms of this include hyperactivity, decreased need or inability to sleep, rapid mood swings, strange beliefs, delusions, hallucinations, hearing or seeing things that aren't there, severe irritability, paranoia, or suspiciousness. The most significant risk factor for postpartum psychosis is a family or personal history of bipolar disorder. Research indicates that those who experience postpartum psychosis, 5% of them are at risk for suicide and 4 are at risk for infanticide. While postpartum psychosis is temporary and treatable, it does require immediate medical attention. And I think that it is so important for family members and partners to be able to know and recognize this because they're the ones who are so close by. As a doula, if I'm working with a mom, I'm definitely going to be checking on those things. But a lot of family members don't have doulas, unfortunately, and so it is really key. And so I want to be able to offer this information so that families can support moms who might be experiencing this. All right. So, risk of untreated anxiety and depression during pregnancy. I have more and more women who I work with who are getting recognized as having anxiety and depression during pregnancy. And I really am so excited that we'd have more awareness as care providers, as primary care providers, as obstetricians and midwives, to note that women are feeling lots of anxiety and depression during their pregnancy, and that we're acknowledging it and that we're treating it. And it is important because if it goes untreated during pregnancy, then your risk for postpartum is even more severe. So if this was not going to be treated, some of the risk for moms are lack of attachment to the pregnancy and baby, increased risk of suicide, increased risk of substance abuse, potential for preterm labor, preeclampsia, termination of pregnancy. Possible risks to the baby may include low birth weight, premature birth, poor adjustment to the life outside the womb, or low APGAR scores. So if you are pregnant and feeling like you may be experiencing anxiety or depression, and you don't feel like anybody is acknowledging that when you let them know that, reach out to somebody else. It's important to, if you don't feel like you're getting what you need, to continue to reach out, because you will find somebody who is going to listen to you and is going to help you in your care and support to healing. All right, so let's talk about that. Finding help, where to start. The really first line of treatment for most pregnancy and postpartum mood disorders is your obstetrical care provider. In an emergency or a crisis, seeking care from providers via the emergency room may be appropriate as well. It is never really too early to talk to your provider if you suspect you may be experiencing PMADs. Early diagnosis leads to early treatment. And I do want to say that, if you have experienced anxiety or depression or any type of mental health distress in your life, note that to your provider when you begin working with them. It is important to bring up and have that awareness and have those conversations, And if you're feeling at all not yourself, share that, because the earlier that you deal and get support for it, the better that your treatment and outcomes are. There are many online screening tools available to parents today to assess the risk of your of mood disorders. The most well-known is the Edinburgh Postnatal Depression Scale. I will include this in my email follow-up to you and on the recorded, so that you will have access to this. As a doula, I always offer this and explain this tool to parents so that they can have it and be able to self-assess and then be able to reach out to a provider if needed. This Edinburgh scale has been proven effective to identify risk. It's not a diagnosis tool, but it can identify an individual at risk for perinatal mood disorders. A score of 13 or above may indicate that the individual is suffering from perinatal depression. However, the assessment does not identify anxiety. So that's really important to note. And hopefully today's webinar will be able to help you understand more what that anxiety might look like. And you can always revisit our webinar at High Country Doula's YouTube channel. The Australian Department of Health has developed a perinatal anxiety screening scale, or PASS, to be used as a tool to identify those at risk for perinatal anxiety. I will include this in the resources that I email out or post online, so that you can have access to that. All right. The approach to treatment for PMADs will vary according to the provider and to the severity of the symptoms. Really, it is important to remember the symptoms are temporary and treatable under the guidance of a skilled and qualified healthcare provider. Let's take a look at those non-medical treatment options first. The first step to exploring treatment options is seeking treatment. Depending on the severity of the symptoms and the potential triggers, there may be treatment options that do not involve medication. The decision about what treatment is right for one individual is a decision to be made in conjunction with your healthcare or mental health care provider. For some new parents, extra support may be beneficial to help ease in that transition. So as a doula, I do this every day to help ensure that as a parent, a new parent, you're getting the sleep that you need, the support, the encouragement, being able to be listened to have the guidance, sharing tips and tricks for taking care of a newborn, and understanding what all your options are as a new parent. It's important, and I think that as a doula, I'm able to come into homes and offer that support, which is so key because it's so hard to get out of the house when you're a new parent. So having help is really key. Even really short term can improve your mood, diminish feelings of isolation, and really lead to better sleep. Also, support groups focused on PMADs is another avenue that some parents wish to explore. Support groups exist both online and in person, and I will note those in the email and the online description, so that if you live in the Tri-Cities or in the Boone area, you know where you can reach out to get access to support groups, because there's some great ones out there. Talking to others who have gone through PMADs can also help you feel like there is hope. So there's lots of non-medication support. For some individuals, talk therapy or counseling with a therapist in a one-on-one setting who is trained and experienced in PMADs is a wonderful first step in coming out of the darkness. These disorders can kind of create a darkness that clouds us. Some other non-medical options include facilitating sleep and making adequate sleep a priority, talking about your feelings with a non-judgmental person like a doula, a family or a friend who's understanding and supportive, reaching out for support when you have a tough time. So I often tell parents in the prenatal period that, you know, what you see in the media and what you see on social media is not a reality of what parenting is like. And it is important to be able to connect with people who are willing to share the realities of that and willing to support you in that. And I think that each of us are going to feel comfortable doing that in a different way. But surrounding yourself with people who are supportive is very key in helping you to heal and feel better. Diet is also an important aspect of that. And when we don't feel good, we often tend to eat poorly. So reaching out for some support, maybe some meal support through family or friends that can offer you that nourishment that you need to be able to have that balanced diet with some quality proteins or specific supplements that are recommended by a provider. And don't be too hard on yourself. Really, just the hustle and bustle of kind of caring for a baby. It's easy to forget to take care of yourself. Even when you're not dealing with a mood disorder, it's challenging, for sure. All right. So along with non-medication, our medical or prescription treatment options, there are a wide range of medications really available to treat perinatal mood and anxiety disorders. And many of these medications are considered safe to take during pregnancy and while breastfeeding. It can take a while for the medications to take effect for some individuals, and it may be necessary to try more than one medication in order to find one that works. It is important to remember to take medications as prescribed and not suddenly stop prescribed medications that are intended to treat without supervision of your care team. I will note, if you have a severe worsening of symptoms while on prescription medications, please contact your healthcare providers or seek immediate support through your emergency room or whatever you need to, especially if you start to feel suicidal thoughts or self-harm. It is important. All right, let's talk about the day-to-day. So when dealing with PMADs, it is really important to plan for long-term, but it is more productive to think short-term. Taking each day as it comes can really help with feelings of not being overwhelmed by what tomorrow holds. Some other coping strategies may be setting goals for each day. For some, creating a today I've done list or a to-do list can help with overall sense of accomplishment. And each day, writing down the tasks that you have accomplished for that day in a place where you can see them. Even small tasks like getting dressed, brushing your teeth, having breakfast, loading dishwasher, and folding laundry can help you see that you're making a dent and moving toward your goals. I often tell moms who are sitting on the couch feeding their babies that, you know, a sense of accomplishment can be just growing your baby. You know, if you are enjoyed reading, sometimes it's like finishing a book. There's lots of ways to have a sense of accomplishment. We just have to look at it from a different perspective, especially if you've been a career-focused parent. That switch can be a little hard because our perspective is one of a different type of productivity, and switching that can be a little challenging. So take a step back and think about the small things, the daily little small things that are important. ask for and accept help. It's really okay to find yourself being unable to do it all. It's just not possible. Utilize visitors to help you accomplish small tasks around the house while they visit. Most guests will ask if you need anything. Learn to say yes. Don't say no. Loading the dishes into the dishwasher, throwing a load of laundry in the washer or dryer, or even running the vacuum can be a huge help. So that's kind of like what they can do, and then get to hold the baby or just hang out with you. Get out of the house. So a lot of moms feel isolated after having, and parents, dads too, can feel really isolating. And you want to be able to support your baby, so you often feel like you need to stay home to do that, or just feel overwhelmed with the aspect of trying to get out of the house with baby. And you don't have to necessarily get in your car to go places. You can take a walk with baby if weather permits, the baby in the stroller and the carrier, get some sunshine and vitamin D. It can be a huge mood booster and can reduce those feelings of isolation. If you have a local group that meets, here locally I lead Babes on Blankets. There's other new parent groups and new mom groups. There's also breastfeeding support groups like La Leche League, a great place to get out and be able to meet other parents who are going through what you're going through. It can be a huge help. Sharing stories and feeling that other people understand what you're going through. Set aside time for you and your partner to bond. I always tell parents, I have older children now, but when we had little ones, Thursday nights was date night, and that date night didn't often include us leaving the house because we couldn't really afford it, but we did make time to be with each other on that night. And so our children learned that Thursday nights was date night. As they grew, they knew that if they got up out of bed that they needed to get a glass of water or whatever themselves and then return to bed, so that we made time and we were modeling healthy relationships. It was key to be able to make it through those early days with young children. So this quality time usually should trump kind of quantity. So it may not be a long time. So just take advantage of the little times that you might have if baby's sleeping. Take a nap together, snuggle on the couch, watch a movie. Just spend time nurturing. It can be really helpful and really key. All right. Postpartum. So I have people that say, like, what do you do for work? And I say, I'm a doula. They would say, oh, like you help with birth? Yes. I am also a postpartum doula. They say, oh, I had postpartum. What they mean is that they suffered from postpartum depression. And the term postpartum has really come to mean postpartum depression for many people. But depression is really only one aspect of the postpartum world. Anyone who has a baby had postpartum. The term postpartum simply refers to the period of time directly following birth of a baby and continues for approximately 6 weeks post-birth. However, this is really more, in my mind, a year to more. As a doula, I'm big on understanding that postpartum lasts for a long time. I learned recently that your organs and your insides take, I think it's a year to shift back, might be 2 years, to shift back from having a baby growing in your belly. And that's just incredible. That really identifies to me that it takes a while to recover. I mean, to really, truly, physically and emotionally, the impact of being postpartum. All right. Mental health care equals self-care. So if we can't take care of ourselves and make sure that you are getting adequate sleep, that you're taking time to go to the bathroom and brush your teeth and eat well, You can't really pour from an empty cup. It is necessary to take care of yourself before you take care of others. I often use the analogy, if you're flying in a plane and the stewardess says, okay, put the oxygen mask on yourself before you put it on your baby or your child. Why is that, right? If we forget about ourselves and we pass out, our babies are not going to get oxygen. So we are the key as parents to making sure that the rest of the family thrives. So it is important to spend time focusing on us and taking care of ourselves. Our society, there's really still a stigma surrounding mental health disorders. And I try every day to try to reduce this. This stigma often keeps us from having open and honest conversations about the struggles and the steps that work to overcome these distresses. Education is really key to erasing stigma from these powerful conversations. And I really encourage you, if you have experienced PMADs, share your story. When you're ready, share your story. It's important. It helps others to understand that it's normal. PMADs is a complication of the perinatal period. And you are not alone. You can get support that you need and help that you need to be able to heal from that. It is really our greatest desire to spark really that open and honest, insightful conversation with providers, with families, with friends, so that no new parent will find themselves suffering alone. So one in 7 women will experience some type of PMADs, and 1 in 10 dads. It is important to keep this conversation going, and I hope that you enjoyed our webinar. Hope that you found some information that will help you if you have or are or potentially could experience PMADs during your perinatal period. I will share all of my sources so that you will be able to have access to some of that support. At High Country Doulas, we hope that you get access to the support that you need. If you have any questions, feel free to reach out to us. You can contact us through our website, through our email address, or give us a call at our office. We'd be happy to get you connected, to answer your questions, or just to listen. So feel free to reach out to us. All right. So non-judgmental support. I understand sort of those stigmas that can exist when it comes to mental health. I really want you to know that there are people here for you, supporting families as they navigate the complexities of pregnancy and birth and parenting. It's really what I and my team are most passionate about. If you find yourself needing help, please reach out to learn more about supportive services, and through having a postpartum doula or connecting with other counselors that are trained. We are really here to help you connect with the resources that you need and to help create that awareness to help your families and friends be able to support you. So I'm super excited to have this webinar and have it be a resource for you and other parents. Thanks so much for joining me here today, and I hope that you found it helpful and insightful. Again, I'm Allison Rollins, co-owner of High Country Doulas. Thank you so much for being here. I'm going to stop the recording and then we'll take some questions.